All right, everybody, we'll go ahead and get started. First of all, I hope you all are enjoying TechStars this week. I know there's been amazing events and such like that in terms of just meeting new people, learning some new things, and for the social impact stage, we're just really excited to be here to add to that conversation and just have some really good dialogue today during this panel. You're here for the Innovations for Health Equity panel. I'm here with Monique, Berkeley, and Jasmine, and my name is Courtney Andrews. Just a little bit about me before I allow the panelists to introduce themselves before we get started. I'm a public health practitioner who is born and raised in the South. I live at this intersection between health, data, and tech. So I'm just really excited and honored to be able to moderate and just be a part of this panel with these amazing individuals who not only add to the landscape of where we're at, but will really have some good information and some really good dialogue about what they do and how they contribute to the field at large in terms of the work that they're doing. So what I'm going to do first is I'm going to allow the panelists to introduce themselves. We'll probably have about 45 minutes or so of questions and answer, and then we'll allow everyone else who's here for this panel today to field some questions to us, and hopefully I'll be able to allow the audience to get maybe a couple of questions in before we close out around 2 o'clock. So without further ado, I'm going to let the panelists introduce themselves so we can go ahead and get started. And anybody can take it, whoever feels called to go first.
Hey everyone, I'm Monique Smith. I'm a Harvard-trained physician as well as medical anthropologist. I'm currently the founding executive director of Health Design, which is our acute care design and innovation center at Emory in the Department of Emergency Medicine. I am also a practicing emergency physician here at our safety net hospital, Grady. I'm also happy to be an Atlanta native in good company with Courtney. Looking forward to today's conversation.
All right, hey y'all, I'm Jazz, also an Atlanta native. And I am really pumped to be here today to talk about the work that I do at the intersection of innovation and inclusion in the global health space. I am a serial social entrepreneur that works in the menstrual health and toilet design space. So really excited to sort of shed a light on that as it relates to the health equity conversation. And yeah, really excited to be here with y'all.
And I'm a visiting professor on staff at Georgia State University in the Entrepreneurship and Innovation Institute. And then I'm also the healthcare catalyst at the Advanced Technology Development Center at Georgia Tech, working with 60 to 80 startups specifically to healthcare. And so looking forward to participating today.
Awesome. So again, exciting, amazing panelists. So really looking forward to getting things going. So for our first question, since you all kind of live at different intersections and the work that you're doing just from your introductions, can you tell me what health equity means to you and what does it look like for your work? And that I really want to ask y'all, why is it important to have a health equity lens when it comes to innovation? And how about we start with Berkeley first?
I would say that, from my perspective, it has a lot to do with social determinants of health. I think a couple of components of that, certainly one of the main ones being healthcare. And so oftentimes when we're looking at that from a healthcare startup, there are some cases where in their design, they're specifically looking at particular disease states where you find that the outcomes are disproportionately impacting different communities. So we know that some communities are disproportionately impacted by hypertension, diabetes, cardiovascular disease. And so I think that when, in working with startups, it's just important to not only look at how that technology or that solution is going to impact that disease state, but in the implementation of that solution, how connected are we to those communities that are more disproportionately impacted by others? And are we including concerns in that implementation that those communities may specifically have? So that's kind of how it impacts the work that I do.
I'll jump in from my perspective as well. As part of Emory's emergency medicine ecosystem, you really span a wide array of care settings, right? So you're talking about your tertiary, hospital with all the bells and whistles. your community hospitals, as well as your safety net hospitals. That is an extraordinarily diverse patient population, right? With an extraordinarily diverse set of needs. And just to tag on to what Berkeley really emphasized there around the social determinants of health, we know that so much of what happens to us and our outcomes from a health perspective don't have anything to do with our genes, right? It depends on where we live, our access to food, water, safety, and our ability to kind of, use whatever money we might have to seek a good and reasonable life, right? And so in thinking about how we treat people, even as like a basic emergency physician one-on-one, all of that comes into play. So it's fundamental in understanding how different populations have different access and how that access then relates to outcomes and how we think about creating an equitable pathway for that.
Build off of that, I mean, I think I am a proud product of the Georgia Tech design school, and kind of when I was in my studies, really learning about how the design and built environment are a key player in the social determinants of health, right? Like, the fact that, a lot of marginalized communities have, infrastructure that they're constantly engaging with that is, it's not working, it's not meeting their needs, it's not safe, it's not healthy, and how that leads to the health disparities that we see in a lot of these communities. And I think for me in particular, as it relates to water, sanitation, hygiene, as we're seeing kind of in light of COVID, there's a lot of communities that don't have access to running water or to safely manage sanitation. And so when we're saying things like wash your hands or, be, cognizant of these hygiene behaviors for a lot of communities that don't have access to, to water sources to be able to wash their hands or to be able to safely kind of engage, with a bathroom facility, a public bathroom facility that, isn't going to put them at risk of contracting COVID. I think we start thinking about how can we create and build environments so that it's inclusive, so that it's healthy for all people.
I love it. I love the segue in terms of COVID-19, because I think I've really appreciated so far that you've all mentioned the importance of having that lens. And I really love that not only, Jasmine, did you mention like the infrastructure and buildings, but Monique, you really harped on like the individual. And I really love what Berkeley said in terms of just really about social determinants of health and having that lens to be able to move our work forward. So my next question too, just to follow on what Jasmine mentioned, COVID-19, a lot of things have happened this year. I know many people have probably mentioned that throughout this week, as well as just this entire year in general. Can you all go into, for the line of work that you all do, how COVID-19 has kind of changed things up or presented some challenges in terms of really kind of impacting the field of health equity and trying to move the needle a little bit forward? And this time I'd like to start with Monique first, and then we can go from there.
Yeah, I mean, this has been fundamental. I'm an emergency physician. So, there's no question that COVID has changed what we do every day, right? And a fundamental part of that is how we communicate. The act of putting on a mask, of putting on a gown and not being able to see one's face, and the need to communicate health information to people in a way that's trusted, that's reliable. Those are challenges that build upon one another. From the center perspective, we were really fortunate to have one of the startups that was working with us to pivot towards the public good and really create this symptom checker pretty early on in March that we were able to roll out, with the idea that it should be in everyone's hand, the ability to understand and to personalize information around what's going on with you and COVID, and then understand what you should do after that, right? So where does that land you? How do I process that information? And one of the challenges that we saw was one related to communication, right? Because it's not just then how do I internalize my symptoms, but then what do I do next? What are the wraparound services I need from the food or housing security perspective? How do I have a continued trusted channel along that? And so really been thinking about how do we message and reach people, and understanding how do people receive information? How do different people understand different types of messages? And how do we make sure that those messages are getting to the most vulnerable and underserved population? So really a full comprehensive kind of view of how do we need to communicate better in person when we're fully masked and gowned, but then also how do we communicate at a systems level to make sure that people are getting the critical information that they need?
I'll go ahead, Jasmine. I thought you were reaching for it, right? We're trying to get that rhythm to go. I think one of the things that, for me, that was very interesting looking at COVID is, when we do look at social determinants of health, one of the issues there is also economic stability. And so it's kind of, how did COVID really impact us from a healthcare perspective, but then also looking at some of the contributions to social determinants of health being really that stability, and how our business environment really kind of was in this VUCA environment. Things were very volatile. They were uncertain. There was a lot of complexity. There was a lot of ambiguity. And I think in some cases it really, we saw a lot of startups really shine. I mean, honestly, from a ATDC perspective, I think one of the things that Monique just mentioned is that she said, hey, early on, we were working with a startup and they had to pivot. And so early in the conversation, we were really asking the startups, hey, okay, so given what's going on with COVID, what's your positioning statement relative to COVID? And we found that a lot of our startups were in this digital health telemedicine space where there was technology that, we could have been taking our appointments or some appointments offline or online, without driving all the way maybe downtown to Atlanta, prior to COVID. But we didn't really allow for that because of just different restrictions or what have you. But we found that telemedicine has really exploded from a COVID perspective. And that has some interesting application when we start looking at folks that were having challenges around access, whether that was access that was geographic or whether that was access dealing with transportation. So that was kind of the positive side of that. But now on the other side, there's certain communities where we find that maybe they didn't have Wi-Fi, or broadband to the same extent as others. And now that became a little bit more challenging. So it was interesting, I think, one on the startup side, just to see how people really pivoted in light of just the challenge, the explosion from a telehealth perspective. And then also just, how folks measured interaction differently. We found some hospitals where they found their patient experience scores went up because now the patients were having this one-on-one individual Zoom with a physician, and they felt seen and they felt heard, which was interesting because now, that's different than when they were actually in the room with the physician. So I think that there's just been a lot of different things, some things that have worked well, some things that have been a little bit more challenging as we examine this experience.
Yeah, and just to build off of the pivoting conversation, yes, we've seen so much of that in the global health space. I think global health at large has sort of had a light shined on it that, I haven't seen in my career to date, right? I think for better or for worse, everybody knows about epidemiology now. It may or may not identify as one themselves, and I think that, showcases the opportunities for kind of growth, innovation, pipeline for the public health sector, which I think is really exciting. And I think too, sort of as we've pivoted and sort of showcased opportunities for public health and social enterprises to play a role in the COVID-19 response, I think there's a lot of really cool ways that organizations have showcased the opportunity for innovation, right? So I think particularly as we're looking at, the water, sanitation, and hygiene space that is directly related to the spread of COVID, you see people, wastewater epidemiology is top of mind for a lot of people. We're saying how can we, look at, tracking COVID-19 in public sewer systems so that we can, mitigate the disease outbreak before it becomes, larger in this community. How can we help this preventative health measure, right? And I think conversations around how can we improve those practices through things like technology, through things like, there's a concept called smart sanitation. So how might we use things biosensors and fourth industrial revolution technologies in our sewers as a preventative public health tool so that pandemics like this don't wipe out communities. And I think conversations like that are really exciting because a lot of times in the public sector, sometimes innovation is sometimes hard to integrate. And I think seeing the need for it now, we're sort of seeing it kind of operating at an accelerated pace. But I also think kind of in light of those conversations, it's a really important time to kind of continue to talk about health equity and the disparities that currently exist, because we don't want these new technologies to be scaled up, to be installed, and to further exacerbate kind of what already exists, right? So if we're installing smart sanitation technologies for people who are experiencing homelessness, kind of how does that disrupt things like HIPAA? How does that disrupt things like health data privacy? And how do we build systems so that people are still safe and protected, but there's still this public health opportunity? So I think conversations like that for me are really exciting, but also kind of shines a light on how organizations are pivoting at this critical time.
To add to that, you bring up this really great point of momentum. Like healthcare has always been just a tough space to move in, the number of barriers that exist just to get to yes and for adoption, right? But in a way, COVID has certainly accelerated not only partnership, but opened the doors and blown them right open from a reimbursement perspective, with Berkeley talking about telemedicine, but then also from the perspective of the willingness to partner and to think outside the box, right? I just think about how we've kind of crossed boundaries from like a community mobilization perspective and engaged with that across digital health and equity. And those are relationships that, a year ago, 2 years ago, they just would have been slow moving. No one signs on the dotted line for the contract that enables the program. Even though philanthropic dollars might be there to move forward, actually getting the buy-in was a lot harder when we weren't in COVID times, right? And so I'm curious how things will evolve beyond this. Now that we've proven that we can partner and get really important things done for communities, how will we allow this to persist beyond the pandemic?
Well, and just to add to that point, Monique, what I think is really interesting about that is when we look at corporate entrepreneurship that's done really well, 3 elements that we tend to see is proactiveness, innovativeness, and risk taking. And so to your point, a lot of times we find in a typical healthcare, like pandemic kind of situation, there's some sensitivity towards risk taking. We're not necessarily the most proactive. We find that the industry is a little bit slower. I mean, even when you look at drug discovery and other things, we're finding that all of that is accelerated kind of in this crisis. And so I was talking to a payer the other day, and they were saying, hey, this is something that normally would have taken us 2.5 years, and we've done it in 9 months. And so we find that. And so to your point, post-COVID, how do you maintain? And it's the same thing that a lot of corporate entrepreneurs are looking at is how do you maintain this innovativeness at the same time when a business gets so big, we have to be sensitive to the operational sides of that business. And so now it's certainly a time when we're a little bit leaning more towards innovative, but how do we hold on to those things?
I love that dialogue. Just was ironic because a phone went off recently. I'm in my where I'm at, and it was playing the Star Trek theme song, which I thought was exciting and very poignant for some of the things we've been talking about just now. So, yeah, and I really appreciate you are hitting on some topics too that I also want to segue for our next question, because we also are in somewhat of a political contentious time with a lot of things going on in terms of what's happening in real time. So I really want to ask you all in terms of this digital divide, because you've spoken to it a little bit in terms of there's a vast amount of new technology. Startups are coming up with some innovative ideas when it comes to COVID and just really trying to, again, move the needle when it comes to health equity and, really kind of get at these conversations about health disparities. But can you all speak to, that a little bit more in terms of how can we address that divide where, some people don't have Wi-Fi or access to different technologies, and how to really have a community-centered, human-centered design with the work that you're doing. And we can start with Jasmine this time in terms of this.
No, I think human-centered design is core to my person as a practitioner. I think, in my head, it seems like the most intuitive way to move through the world, but it still is so challenging. And I think there's so much opportunity for it to be further proliferated. So really happy to sort of speak to human-centered design as it relates to the work that I do. I think I mentioned smart sanitation as sort of this field that it's happening, right? Like, technology, the Internet of Things, it's coming to kind of these products that are in our bathroom that sort of relate to, the data or like the waste that we just deposit right into the public sewer system, and sort of what does that look like in terms of like people that perhaps don't have that understanding about data privacy. What does it look like for people who perhaps don't trust things like sensors, right? So if we're integrating things like technologies into public systems that you're using on a day-to-day basis, like how do you communicate? How do you bridge those gaps? How do you protect and further ensure that people don't feel like kind of some of your most private moments are being like watched, right? And I think like these are really, again, important conversations about kind of the technology side and the opportunities there, but it also needs to be married with the human side and like kind of what people believe to be true, the histories of different communities as it relates to technology and big tech. and kind of making sure that things are scaling in line with community understanding. So it's not creating further distrust or further tension. I think too, there's been a lot of really interesting conversations about smart sanitation on the individual level. So what happened, what could it look like if your toilet was a smart toilet for like your individual purposes? And I think, again, like as a health diagnostic tool, it could be really interesting. I think as, for people who perhaps don't have access to the healthcare system, if they had access to a smart toilet, maybe that could help bridge some gaps there. So again, really exciting technology, but also kind of these conversations about how could you be protected? How can you make sure that communities understand and don't feel like they're being taken advantage of, or that, their data is being used to further exacerbate inequity. So I think there's that tension, and I think that tension is always there, but making sure that, again, as we're moving through this COVID time and as we emerge out of it, that conversation about like the human-centered component is integral, right? Like, I think like that is sort of the key piece to making sure that we're designing things sustainably and inclusively.
Yeah, I would say that go ahead, Monique. I would say that one of the things that's just been interesting in the season is that oftentimes, startups, when we're doing, customer discovery, you're there present with your customer in some capacity, so you can observe. And there's so much around nonverbal communication. And in this environment, largely that's taken away, even more so in healthcare. And so I think one of the things that has just become more important in this season is really listening. I think a lot of times when we talk about the divide, it's because, in many cases, I'm ready and I want to come in and I want to express, but I don't necessarily want to listen. And so we find that the startups that are doing really well here are just taking the time to listen and to hear from their customers and listening to the pain points that clinicians and providers are facing, listening to the turmoil that payers that payers are going through, listening to just the different challenges that different patient communities are experiencing. And from that point, I think what they're finding is that although there's definitely disparities, there is also some of these common themes that we find that the startups are now focusing on. So a common theme might be access. And so, now where there were folks, previously that might have been challenged, with logistics or transportation and getting into the city to go see their physician on time. Well, now we're finding that access, that problem has been broadened, right? So now, even if you were, living in the suburbs and, you could normally get there without a problem, hey, the hospital's saying, hey, line. And so that has been broadened. And so now we're finding that, startups and providers and others alike are looking at that problem and saying, okay, so how can we fix that for everyone? And so there's been some kind of inclusiveness because it's not like, hey, COVID is stopping, COVID is impacting Bankhead and it's impacting Buckhead, right? And so because of that, now we're finding that some of the solutions that are coming out of that are by default inclusive. And so I'm hoping that maybe some of the things that we're learning is that there are some more shared experiences. If we listen to those, do really good customer discovery, and we listen to that, we can actually create solutions that have a broader impact. And to Jasmine's point, right? I mean, they have a global impact as well as a domestic one. And so that's one of the things that I do see some organizations doing during this time.
I love that you landed on this point of how the digital divide is certainly uncovering the fact that we have not been about inclusive design, right? That often we design for a very slim slice of populations, right? So Pew Research just has some really great statistics out there, right? So 96% of Americans are using smartphones. When you look at who has broadband in their house, that's a very different statistic. So about a quarter of Hispanics, a little bit less than a quarter of Blacks compared to 12% of whites are smartphone dependent only, meaning no broadband at home, no other devices, just the phone in their hand as the way of engaging in this tech-enabled world, right? So what does that mean for what we're actually doing in the digital health space, right? So I'll give you the example of the symptom check, your C19 check. That's something that we designed, that's web-based, it certainly works on both feature phones and basic phones as well as smartphones. But when you think about that in a global context, you have to think about it in places that don't have connectivity. How do you transition that to something that's based on a text message, on a USSD flow, so that people are still able to access that same type of information? Same information, same solution, coming through a different channel, right? And that's the key part of this. As we try to span this digital divide, the solutions that we make, we have to have these nuanced elements of how we think through the channel opportunities and all these other elements that come out of customer discovery to understanding how you design for entire populations rather than a singular slice of the population.
Cool. I love this conversation. And if you all saw me like speaking into my camera while I was talking, it's because my internet is just trying to be a little froggy today. So trying to make sure that's okay as we keep going on this panel. And I really appreciate the responses that you all have, because again, I think one of the things that I've heard a lot in terms of where we're going is really just speaking again to technology and really making sure that humans are at the center of that in terms of what's going on, that making sure those who haven't necessarily had access are able to move forward in the right direction, and making sure everyone's included in that design and making the right adjustments as needed as you test things out, model and just readjust as needed. Really appreciate that. So one thing I want to ask as we keep going is, based off these conversations and dialogues that you all have had with folks and the partnerships that you've had to build, what's something that has really impacted you or influenced how you approach certain things? I'd really love for you all to speak to, what's something that you really learned this year that's like, wow, that changed the game for me, or actually I used to do it this way, but now I'm thinking about approaching it this way going forward. And anyone can start in terms of answering this question.
I can jump in. I do sort of want to add like a segue point from the last question. I think, again, coming from a STEM like product design background, I think sometimes we talk about innovations and technology and it's like we have a vision of what that is. But I also want to shine a light on the fact that there are certain communities, indigenous communities, where technology and what that means can look very different than what we traditionally think that could mean. And I think it's really important to honor that. So just wanted to flag that, because I think sometimes we think a lot of bells and whistles means technology, but sometimes that's not what's needed. And then I guess segueing to your next question, Courtney, I think, has what's been talked about a lot in the past year. This has been a time of a lot of hardship, a lot of darkness, a lot of challenge, a lot of just reckoning, and globally, locally, and I think, for me, it's been a time, again, sort of using human-centered design, using the design thinking process to really challenge myself to reframe this period into a generative opportunity to say, how might we emerge so that we're better, right? How might we emerge so that we're designing better, we're creating better, we are more inclusive, we are more sustainable. The fact that conferences are online, like obviously there's pros and cons to that, but the fact that the sustainability implications of that is so incredible. Like, how might we think about, how we can convene as, a sector, or as, a community of people practicing something in a way that is more sustainable? How might we think about things like, sanitation or menstrual health, so that, when the next global crisis, hopefully not doesn't happen again, but in the event that it does, people aren't without menstrual health products, right? Like, that was something that was breaking news kind of over the summer. There was a big movement, periods don't stop for pandemics. The fact that menstrual health products were considered a luxury good and not considered an essential hygiene product for so many people around the world. And the fact that a lot of supply chains were disrupted really just showcase that there's an opportunity to innovate in terms of the entire system around menstrual health, as well as actual products and services that are meeting various needs within the space. I think, again, from a product design lens, like, we have so many, car designs and toothbrush designs, but when we're talking about toilets, we're talking about menstrual health. There's very few, things that are currently on the market right now. And I think, again, as we emerge from this time, how could we do better? Because we're not reaching everyone, and it's very clear now. So I think that reframe has kept me energized and has kept me sort of focused on how the future might look.
Tag on to that and talk about how we've really had to rethink how we engage. Fundamentally, so much of medicine has been this face-to-face. You can see my smile, you can see my frown, you can hear the intonation of my voice. And part of that's how you even understand your own illness on the other side, right? And as we kind of grow into this age of telemedicine and now shared spaces where there's more contact, how do we also bring the science along with that, right? How do we move from, laying a stethoscope on somebody's body to understanding how continuous measurements around lung sounds or around different, biomarkers or allow us to predict in better ways who's going to do well and who's going to do poorly? How do we move those pieces along in meaningful ways for meaningful populations? And then also, how do we think through, models that we have that exist, acute care in telemedicine? How do we think about creating that for people through avenues through which they usually travel? The number of folks who call 911, who use EMS, leveraging that as a point of contact and engaging people who might not find their way to platforms as a way of providing care, right? And leveraging this idea of teleparamedicine as a way of kind of reaching at-risk and underserved populations. So really kind of with a totally new lens, thinking through the things that are literally right in front of us, right?
Yeah, I mean, I think that there's just so much to learn from. I mean, from this period, it's almost like there's this. It's a great intervention. We talk about how we measure before an intervention, and then we intervene with something, and then we measure and see how things transpired afterwards. And I think for me, two or three of those lessons that have just been I guess that float to the top is one is just the power of pause. When there were just so many things prior to COVID that could grab our attention, the next Fast and Furious movie coming out, or the what's going on Broadway, or the NBA playoffs, and this, that, and the other, and all of those things can be great things, but in some ways, I think that I could get focused on those and lose focus on some of these social issues that we're discussing. And I think that there was a huge pause during COVID that actually allowed us not to notice things that were already there, and to notice them and to see that it was well within our capability to address some of these concerns. And so I think one is just that power of just stopping and listening and just kind of taking in and pause. And I think that because of that, it's actually broadened this conversation around social impact. As you've seen a lot of, corporate entities and others that have become more focused and have wanted to become part of the solution regarding just different challenges from a social perspective. And it wasn't that those things weren't present prior to COVID, but now after a pause and kind of assessing one's capabilities and saying, hey, I can be a part of the solution, I think that has just kind of broadened really this focus and this interest in social impact. And then I would say lastly, is just seeing that there can be a tendency at times for us to have to prioritize process over people. And I think that for me, that's really, a lot of the stories and the things that we see, from someone not being able to be at their loved one's side, in the hospital with COVID, or seeing, really the impact of that, that family caregiver, when someone's in the hospital and they're getting instructions as it relates to, what to do. My father, had surgery during this time, and not being able to be there to say, okay, these are your prescriptions, this is what you need to do. And having to get that from him to do it, you're like, wow, so I think that there's just this, I think a lot of times we kind of looked at, hey, process from a perspective of, maybe software engineering or design, but not necessarily really kind of weighing the human elements within that process. And I think that we are learning how important that is from a community perspective, during the season. So.
Gotcha. I love that. Yeah. And I want to say that I do appreciate, again, these responses. I really appreciated, for example, Jasmine, you mentioning about, communities that have been, left out of the conversation and haven't had the space to really be able to be a part of the creation of what this new vision is. When you brought up Indigenous communities, I also thought about the disability community in terms of, really making technology that's not ableist, but also really gives people the ability to, be at conferences like this, or have closed captioning or sign language and those types of things that people have talked about before COVID hit, but now it's becoming more of a conversation and a thought process for all of us to really think about, how can we have folks were included, but not necessarily tokenized, but really having community buy-in and having, the solutions that have been around for a long time really be at the forefront along with, these new technologies that are emerging as well. So really appreciate that and all the points that have been made so far in terms of this conversation and dialogue, because it's really important for health equity to kind of be innovative in our ideologies and our thoughts, but also really build these bridges too that often people don't necessarily want to build bridges for, or at least aren't thinking about in the context of the work that they're doing. So I just have one last question before we do have some from the audience that I do want to get to for today's panel. I just want to ask you all, do you have any recommendations or insight for those folks who really want to jump into the health equity space, who really just want to be a part of that change when it comes to, eradicating health disparities and health inequities and really, getting more involved in the work? And anybody can start in terms of this question.
Yeah, I'll go ahead. I think there's a ton of amazing organizations out there. They're doing amazing work, in the US, in the world. I'm happy to share some of those resources. But I do think something that I kind of going back to some of our previous conversation, I do think, there is some need for some intentionality about understanding human-centered design, or like understanding what it means to like be human-centered in your problem solving or in your giving or in your practice. And I think if you're not familiar with the practice, there's a ton of resources that I'm happy to share. I know if you're based in the Atlanta area, the Museum of Design Atlanta is offering Design for Dignity as a series of free courses online, focusing on communities that are often left out of the conversation when we're talking about the design and built environment as it relates to health. So I think they're doing incredible work. I think just exposing yourself to potentially those tools and that process and that way of approaching problems, which I find a lot of power and promise and generative opportunities from, and I think a lot of other people do as well. I would sort of recommend leaning on some of those resources and then being intentional about how you go about your donations, about how you go about spending your time, so that it is with the most impact as possible and not higher on the surface level. So that's sort of what I would recommend. I know that was like a higher overarching kind of recommendation, but I think that's sort of what I think would be the most generative in terms of your time and your resources to make sure that it is really sustainable and people-centered.
To build on what Jazz said, I think it's partly about embracing common sense design principles, right? Where we're really starting to think very intentionally about designing for a perspective outside of our own, right? And also thinking about designing for generations, not this particular moment in time. And when we start to do that, we start to develop solutions that really are able to affect an entire community, a really diverse population, right? And then another element within that is also understanding the stories that exist within those communities. When you think about health and healthcare and its storied history in this country, there's certainly fundamental elements of trust that no technology is ever going to be able to fundamentally bridge in and of itself. So, you're designing the service alongside the thing that enables the service, right? And so how do you start to do that? How do you start to think about how different micro segments adopt things differently for different reasons? And how do you start to think about why these behaviors exist and how we might respond to these behaviors, so that we're really thinking through how we can best meet people where they are today?
Yeah, and I would add to that. I think that, really looking to contribute is that does that really align with your interest? I think a lot of times when we think about healthcare inequities, we just focus on healthcare. But, some of these contributing factors, right? When I look at it from a startup perspective, we know that as it relates to the pandemic, there were estimates, Bloomberg, Forbes, and others that have said, hey, 40 to 45% of Black-owned businesses would not survive the pandemic. So if I find myself in a space where I'm a little bit leaning more towards entrepreneurship and just daily business and how can I help a business to survive during this time, that's a great way to kind of contribute, because we know that the impact of that is going to have impacts as it relates to healthcare inequities. So I would say really kind of, participating in and getting in those areas, whether it's education is one, social community design is another. And so really kind of aligning with those areas that you just have a love for anyway.
Awesome. Love it. Yeah, I think you all have spoken about ways, whether it's, finding some training opportunities or educational opportunities, to just really just saying like, hey, how can I help? Can I be a part of making sure your business thrives? Can I be a part of the healthcare infrastructure to make sure that we're, communicating and having different perspectives that are outside of our own? I really appreciate that because it kind of gives people different entryways to think about the work that they do, and also just plan for not just this moment, but the moments that are come forward. Really thinking about, to me, as I always say in some spaces, there's a blueprint that's out there, but we just have to add to it and build upon it in order to do the work and move things forward. So yeah, I just, like I said, want to leave space for the audience. I know they have a lot of questions for y'all in terms of the conversations we've had. So the first question I see from the audience is someone asked, how do you see health informatics being used to achieve equity in healthcare in the near future? And anybody can take that question.
I'm happy to start us off. We definitely play heavily in this space, and I don't know if it's because we come from an academic center, we believe in data, and we understand that data means something, but it is coming down the pike. And the question is it coming down the pike in a way that is nuanced to what is hidden within the data, the things that are missing, right? So we know that there's implicit bias in our system. So the decision that I make as a provider for someone who is a white 45-year-old male versus a black 45-year-old male versus a Asian 45-year-old female, they can all be different, and not because of the symptoms that they come to me with, but because of the fact that the way we've trained, the way we interpret people and stereotypes, and also the way that we understand what they're saying to us, that then becomes codified in the decisions that we make. So the caveat here is that absolutely health informatics is part of this coming wave of how we practice medicine, right? And the role that we have is shepherding that in a way that's conscientious and understands what those implicit biases are and how we start to deal with that in the way that we start to both algorithmically learn from what the data shows us, and how we kind of uncover that missing data to discover new highlights and new nuances that allow us to address some of the fundamental things, such as the social determinants of health equity, such as the fact that the tools that we give people aren't necessarily suited.
You go ahead, Jazz.
Yeah, I mean,
it's like Family Feud. He's gonna hit it first.
Like, who's gonna go
first? Yeah, just really briefly. I mean, I think just to build on what Monique said, I think that there's a lot of power in health informatics on like the individual level to be able to understand and advocate for yourself and your loved ones, and being able to know sort of to know what you know and to back it up. And I think there's a lot of power there too, that I think that there's a lot of room for innovation, disruption, and dissemination.
Yeah, and all that I would say with it, I mean, I definitely agree. Deming said, hey, if I can measure it, we can improve it. And so I agree with that. The only caution I would say is just make sure we add context. I mean, because I think a lot of times, once again, that process in people. So what's the context around that data? Because I think that really helps us to make sure that we design solutions that are just a better product market fit.
Cool. And yeah, I really appreciated what Monique brought up in terms of like algorithms, in terms of like really making sure that any algorithm or data that's collected really has, again, that touch of not creating a bias that would, hurt people in terms of the work that can be done. Just to point at a recent study, for example, that actually got information from a hospital. They found that there was an algorithm that was created that actually created a health disparity because of the way it was programmed. So I really appreciate this question because it speaks to the fact that technology is so great, but having a cultural humility or cultural competence and really just keeping that focal point of making sure people are, included and thought about in terms of any technology is super important. So I just appreciate that highlight, as well as the other comments in terms of how important health informatics is. I love that. I want to learn a bit more. I'm a behavioral scientist. So I get geeky about data, but we're not going to go there for today's panel. But actually, Jasmine, I do want to segue to you for a second. Can you speak to, because of some of the innovations that you do, can you speak to more about period futures in terms of, related to this question as well as just in general? I'd love to hear a little bit more about some of the relatedness to this.
Yeah. So I think kind of in true 2020 fashion, I connected with some brilliant designers from the Bay Area. They graduated from the Stanford D School, and we met on, online through a conference, and then we started this venture together. So I really haven't met them in person, which is still really crazy. But basically, we're on this journey of kind of disrupting the way that we think about periods and period havers, and how we can create like an inclusive, sustainable future for everyone who has periods, because again, it impacts 50% of the population. It is a life course experience. So, depending on who, what your life looks like, and kind of your genetic makeup, depending on your, a lot of things, your experience can look very different than someone else's, but it is something that changes over time, which I think is, again, just mind-blowing to me that that's not as mainstream of a conversation, just knowing about it, because I think sometimes people get really stressed out when they're like, oh my gosh, I'm very sick, but it's like, no, that's normal, you're okay. And so I think, A, it's about like creating space for conversation. B, it's about creating a community for designers, engineers, creators, makers to say, hey, like, how can we actually make some of this stuff that's different, disruptive, more sustainable, more inclusive? I think, I mentioned before, there's a host of products that we have, for cars, for driving, right? For different experience, different price points, different XYZ. But again, for the 50% of people that experience periods, we have two types of products. They either collect or absorb, and that's it, right? Like, there's a ton more out there that we just haven't tapped into yet in terms of experiences that people have, or that, price points that they have, or sustainability experiences, to make it more circular. And so I think part of what we're trying to do with Period Futures too is to showcase what some of these things could look like. And not everything is for everyone, right? And I think that's sort of the point, right? It's not one size fits all. And when people say they're innovating in menstrual health, it's not about, just designing a different pad, right? Like, there's so much more that we can be doing there. And I think having some of those conversations about, what could it look like to create systems in public bathrooms so that if you dispose of your menstrual health products, it turns into some sort of generative, power source for that bathroom, right? Like, what if it was a circular system that, in the input was like menstrual health products? What could that look like? What could it look like to have VR educational experiences for people who either are experiencing menstruation or don't, to codify this empathy, this understanding, this conversation, this, understanding that menstruation is a part of everyone's lives, whether you sort of recognize it or not, to sort of create space for shared experiences and learning. So yeah, we're sort of creating a series of provocations, is what we're calling them, about what the future of periods could look like. We're working with innovators and working with designers across the US to sort of talk about what it could look like to build some of these futures. And then we're also amplifying some diverse founders within the menstrual health space. So a lot of Black, LGBT, Indigenous founders in menstrual health are working at grassroots levels, and we're really trying to amplify and showcase some of the incredible work that they're doing that isn't always mainstream in the period space. So that's a little bit of what I'm doing with Period Futures. It is a very 2020 venture where, again, I have not met my founders in real life, but it's been an incredible experience kind of talking about how to use this time to be generative for the future.
Yeah, thank you for making space to speak to that, Jasmine. I really also love the fact that with the work that you all are doing, it's very inclusive. I really love hearing that there's LGBTQ, queer, trans, and or non-binary folks involved who are founders who have been in this field and doing this work, as well as just, a space for people to come together and really think about what the future of periods are in an inclusive way, in a manner that, it's going to move us beyond just talking about pads and tampons and things like that in terms of conversations. And I also love that that y'all's group is highlighting the grassroots effort in terms of makes you think about some of the work that I'm doing in public health that really works with activists and organizers to try to build these worlds in terms of what health equity could look like in the future. Thinking about like the Black Panther Party in terms of like the free breakfast program, all the way down to what's going down with COVID, and really having equitable data, since part of Data for Black Lives and a lot of other organizations who are doing some good work to really get deeper about, why we have the infrastructures we do. So I want to get another question from the audience on the board here. I feel like I am playing Jeopardy. May Alex Trebek rest in peace, though, in terms of him recently passing away. Another question we have is, if you had a crystal ball and could develop an app that would have prevented the excessive toll taken on the Black community for COVID, What would that app look like? Or is the idea of an app overly simplistic? And we can start with either Monique or Berkeley in terms of this question. And then Jasmine, feel free to pipe in too whenever you're ready.
Yeah, an app. I think that's the first place to start, right? And this gets back to the idea of, one, why do people use the things that they use? So one, is an app accessible to the Black community that is most at risk and has been the most at risk for COVID? Two, is there the fundamental trust there if something were to be developed and put into an app? If you don't attach it through community anchor groups and trusted voices, right? One of the things that we found in trying to reach people in underserved communities in COVID is that the sweet spot is this intersection, right, of like your classic community mobilization, grassroots work, and really working with people who have trusted and valid, connections that last for, way beyond this pandemic in the communities where people are being disproportionately affected, and leveraging technology alongside that. Right? So taking that piece of the trusted voice and putting that trusted voice into the technology to continue that line of trust and to expand the dissemination and reach piece, right? So I think that's one component. I think back to kind of early March and sitting in a conversation, which was, relatively mixed crowd, and hearing remarks of, well, folks in Africa aren't getting it. Black people must be good, there's no app that addresses that, right? The only thing that addresses that is kind of human interaction then impacting behavior, right? So I think if I had to create something, it'd probably be a little bubble device, like the little bubbles that people used to play around. And I don't know what game that is, where everyone's in a bubble and they're like running around in a field in the bubble. That sounds terrible to live in that bubble. I hope people can communicate in that bubble, but I think that would be my first go-to. We'd all just live in the bubble and see how that went. Probably not well, but that's my best guess.
Yeah, I think I would start off with something that basically kind of measures, your level of risk, right? So we know that if we're looking at, from a COVID perspective, now defer to Monique, the physician on the line, but it's almost like, hey, if there's if you have other comorbidities, so if you have, diabetes, if asthma, so kind of creating this construct to get a sense of, okay, so what's your risk level at the individual level, and then rolling that up to kind of represent a community. And then once we identify those kind of risk levels, some of the things that you can see with machine learning, even as, something around taxes, where you find that as you're doing your tax, they'll say, hey, your likelihood of being audited, and then it'll reduce as you do different things. Well, we could say that, okay, this is your at-risk level from a COVID perspective, given your kind of individual comorbidities or what have you, lifestyle, this, that, and the other. And then as you do these things, if you're only going out in a group of 10 people or more once a week, what does that mean to your risk level? What is it? And so I would look at maybe something like that could inform the individual as it relates to just their conditions and then their lifestyle, how much I socialize, how much I find myself exposed to different ages. Am I working at the hospital every day? And then constructing it in that way, that's kind of what comes.
That we probably have to fundamentally redesign society and who takes on what roles in society, right? So this app would allow people to then have new jobs and new ways of doing those jobs, right? We know part of the spread of COVID in Black communities has to do with the disproportionate number of Black people who continued and had to go to work so that our society could keep functioning, so that we could keep eating, so we could keep, having safe houses, so that we could keep getting healthcare. Those are all parts of it, and those parts aren't contained within the app within an app in and of itself. And so that's the part that extends to this conversation of how do we design for social determinants of health equity? How do we start to address these fundamental elements that exist in our lived places and the way that we live our lives, because that's the only way we can live, to really kind of get to the core of it all.
Yeah, and I would just add, I think all of what's been said has been fantastic. I think it would be really cool too if the app was like connected to this future smart sanitation city. So you could see like on like a GIS mapping or something, sort of what communities are being disproportionate, like where like early signs of COVID or early signs of X disease are like being detected in wastewater, so that you can say, hey, like, you know, it's going to hit this like Black community, like let's like intervene before it becomes, you know, something that wipes them out. So I think that could be a really cool overlay to this app as well.
I think we want to transition to a yes and exercise. Yes, and also I know where to pick up my PPE.
Yes.
I love that. Oh my goodness. You made me think of I always have to throw in a Black Panther reference, but I love Afrofuturism. So I just thought of that in terms of smart cities. I love that. I also played SimCity, if anyone played that as a child. That's dating myself in terms of me being a millennial. But I love it. That sounds like a really cool app. I hope somebody designs it, honestly, especially with ArcGIS and these visual apps that people have. That'd be super cool, making it accessible as possible. Well, I mean, we're coming up close to the hour, so I just want to give our panelists, if they have any closing remarks or any last words for folks in terms of our conversation before we let all of y'all go enjoy the rest of Techstars for this week. And we can start with whoever wants to go again in terms of some closing remarks.
I'll lead. You know, I think the space of equitable tech-enabled care is one that is blowing up. You know, not a lot of people have thought outside of a very slim segment that adopts health technologies. And frankly, from a business perspective and a markets perspective, there's a much bigger market out there. So I think there's really a true opportunity to start thinking about diverse populations in a way that actually finally aligns with financial incentives, right? And aligns for the incentives that we're going to see, not just for individuals who are willing to pay out of their own pocket, but also for payers and large employers who are starting to think about their working poor in new and different ways. So I just want to say, hey, this is a great space to jump into. Don't let the healthcare piece intimidate you. It really has a lot of opportunity, and I think it's really quite fun.
Yeah, I mean, I would just say, I mean, you know, move into this space like an entrepreneur, right? I mean, don't be scared to make mistakes, you know, take risk, be proactive, innovate. I would give a quick shout out to Sonia Booker, who is actually trying to kind of focus on that from a with Studio House Atlanta. When we look at, once again, 40 to 45% of Black entrepreneur or Black owned businesses aren't expected to get out of the pandemic. And so she's trying to create a solution to bring attention to that and to really kind of help from an economic perspective, which contributes to social, you know, social determinants of health. So I think that would be the biggest thing is, you know, when a lot of times we can go to events like this and we can get excited, but then do we take it and move it and put it into action? And so I would encourage folks to do that.
Yeah, and just as another build, I mean, I think there's so much opportunity in this space. It is really exciting work. I mean, it is hard work. It's hard work, but it's exciting. And I think I would recommend you know, exploring the sanitation space. I'm, you know, obviously very biased, but I think there's so much, again, opportunity for a piece of our realities that impact everybody's health, but is something that nobody wants to talk about. And something that, you know, the toilet hasn't been like reinvented in 200 years. You know, the systems that we have in place work, but it's not always going to work. Like population size is increasing, and the only resource that's going to increase with population increase is the waste that we produce. So we need to create systems that are intended to be more circular, that are intended to be more inclusive, so that we can still live healthy lives as population increases. So yeah, I would definitely invite y'all into this conversation in the sanitation hygiene space. There's a ton to be done here. And yeah, happy to continue the conversation if you're interested in learning more. Thanks so much for joining.
Yeah, so we're right at time. Just want to say thank you again to Monique, Berkeley, and Jaffin for making time. Thank you all for letting me moderate despite some technology issues trying to happen on my end in terms of things. But we really hope you all have enjoyed this panel. As someone who's a behavioral scientist and health educator, as well as someone who's in the grassroots public health movement in terms of health and healing justice and those types of topics, these conversations are really important because we all need to work together to make the world more equitable and more just for everybody to be able to have healthy lives, whatever that means for them in terms of the space that they're in. So thank you all so much. Please enjoy the rest of Techstars. Please enjoy the rest of Veterans Day, and just please have a nice day, wear a mask, stay safe, and just stay well. So